Good morning, good afternoon. Hello, my name is Tatanisha Rice, and I work in the Division of Youth Development and Partnerships for Success here at OCFS. I am happy to welcome you to our Lunch and Learn today in honor of Human Trafficking Awareness Month. If you require technical assistance during this presentation, please reach out in the chat for assistance. Today's session, Developing a Response to Trafficking and Related Issues in a Rural Community, will be a panel discussion facilitated by Taylor Monet, the Herkimer County Safe Harbor Coordinator. Taylor is joined today by Joseph Gilfus and Taylor Borden. Please excuse if I did not pronounce your name correctly. And with that, I'll turn it over to Taylor for further introductions. Thank you.
Good morning, everyone. My name is Taylor Money. I am the Director of Safe Harbor and Treaty Programs here at Catholic Charities of Herkimer County. And today we are going to talk about how our program has developed a response to human trafficking and exploitation here where we have a more rural area. I know for some people that may come from larger cities or more urban areas, they may not know the signs, although it does still happen here. It may look very differently, especially if you have some overlay of clientele that may come from one area to the next. I think it's very important to be able to identify different risk factors, gaps, red flags between both the rural and an urban community. I'm just going to share my screen. Okay. Can someone just unmute and let me know if you can see it?
Yes, we can see it.
Perfect. Thank you. All right, so Safe Harbor here in Herkimer County, it may look different than other counties, which I think is the beauty of this program overall, is that we can kind of tailor it to what is the needs in our certain areas. This program has been around in our county here in Herkimer for since 2017. We have been a graduated program since 2022, which means we've met certain milestones that we needed to for the program. And I myself have been facilitating these programs since 2019. So I'm very proud of where we've come from and how different things we've had to learn. So I think it's important that we share that with other communities, whether they're rural or urban. So just to give you kind of an idea of what our county looks like, if you've never been here before, I'm sure many have not, maybe some of you have. We have a population of over 60,000 people. We cover a little bit over 1,400 square miles. So you can see here on the map, we do have some towns and villages that are very close together. But then we do have some like Town of Webb in Ohio that are further out and they cover a big area. So while we may have youth that live in the closer areas or they come to these certain like schools or doctor's appointments or DSS where they might be identified at risk or actually being trafficked, we have to think about where they live, where they are most of the time. And for some of them, it's these more rural areas where they don't have access to certain resources that maybe some that live closer to others may have. So we do have 19 townships, one city, one village that's categorized as urban. I wouldn't call it like New York City urban, but it's categorized. We have 11 public school districts and then one college. And here's some information from the community needs assessment that was done by MDCAA here in our county. So we see our most vulnerable areas are financial support, housing, and food and nutrition. And what this shows to me is that there are a lot of vulnerable areas, high need areas that could put someone, whether it's their family, themselves, in a situation where they could be exploited or they're just vulnerable in general to need these certain basic needs. And just continuing some information from the community assessment report, we do have 39% single parent households. We do know that affects those families that only have that one income. and then 38.1 are unemployed from the ages of 16 to 50. So we do see a little bit of poverty here in our area, and families that are struggling, individuals that are struggling. So what about our rural areas that are so different and our vulnerability factors? Some of these are the same as more urban areas, but just for different reasons. So we have isolation and limited resources. So rural communities can be geographically isolated. Like I said, we have the town of Webb, Ohio, even our Dolgeville area, some of our Little Falls areas that, they may have a town area, village area, but some of those other communities where those families are living are on the outskirts of town, and they are more farmland areas. So they have limited access to resources like law enforcement, healthcare, social support networks, especially if they don't have transportation. So a lot of times we may only see or be able to see these clients or identify them at public places like school, doctor's offices, ERs, if they come in contact with police. Being in a rural county, we do often see that we have limited funding, just being that our numbers aren't as high as some other communities, some other areas in the county or even or in the country or even in the state, which makes it hard for us to be able to access and fill those gaps where they're needed. We saw about the poverty that we saw from the community needs assessment report. Obviously we're seeing poverty all over the country, but we also see it here with families that struggle and may not have as many resources or availabilities for jobs that others do. And then finally, we have a lack of awareness. Let's see. Can everyone still see my slides?
Taylor, they're not moving.
So we're still on the first one?
Yeah, still in the first
Okay,
one.
I can't see any of the chat, so I can't see anything. Let me see here. Go back to the sharing. Okay, let's see. Okay, can you see the screen now?
Yes, you're sharing the WebEx.
The WebEx. Okay, it's on the presentation. Okay, let's try this. Can you see the presentation now?
Yes, it's working.
Is it moving?
Yes.
Okay, sorry about that. Okay, so like I said, I can't see the chat, so if you have any questions in between this, please just unmute yourself, and I'll be able to check the chat at the end. But just to catch you all up to where we were, this is a map of our county. So we, like I said, we have some of these smaller villages and areas that are closely together, but believe it or not, even the outskirts of some of these villages, like areas, towns like Little Falls, Dolgeville, even some Herkimer areas, Litchfield, they are still very much rural, farm, country lands. So not everybody is as close necessarily. And then town of Webb in Ohio, even more so. This was the community member survey where it showed our highest needs, which was financial support, housing, and food and nutrition. Our statistics on single parent households and unemployed. Our vulnerability factors, which are isolation, limited resources, limited funding, poverty, and lack of awareness. All right, now we should be caught up. Everyone can still see?
Yes.
Okay, thank you. All right, and now I know we may have some people that are with OCFS, with Safe Harbor, human trafficking, and we may have others that are not. So just to go over some types of trafficking that we see, obviously we see sex trafficking, but we also see labor trafficking. And the reason for this is because, like I said, we do have farmland here. We do have different businesses here. So it is interesting to see specifically in our county, having rural and what they call one urban categorized town or city, the difference between what kind of labor trafficking can occur here, or how some types of sex trafficking can be carried out in this area that may be totally different from the methods that are used in other places. So for example, I know when we think about trafficking in bigger cities, we may think of like pimps, traffickers, gangs. And while we still may have that kind of setup here in Herkimer County, we see it a little bit differently more times than not. So instead of having your typical maybe like blood and crip gangs that maybe we might see in a bigger city, we do have organizations that come together, whether that be family members, certain affiliations, different types of gangs. So some of them that we have, and this isn't to exclude all of them, but meth labs we do see a lot of, being that we're in a more rural area. It's easier for these types of setups to happen. But with that does come the trafficking and exploitation. It kind of becomes a whole big operation. Different drug dens. It's harder to identify because, like I said, they're not necessarily happening right next door to a police station or to a school. They could be happening in our more outside the outskirts of our towns. We have different gangs or organized crime, could be illegal organized crime biker gangs, or even segregated communities. Like we have, a high Amish population here. And it's not to say that that one group of people is trafficking, but it is harder for us to identify when we have such segregated communities here. Then we have the familial, which is the family-owned businesses. And again, it's interesting to see both in the very small urban areas that we do have here and in the larger rural areas, the family-owned businesses. So like I said, the farmlands, but we also have nail parlors, massage parlors. One of our smaller towns, I believe it was a year ago, it was in the news for having one busted at a massage parlor, and there was trafficking and exploitation happening there. And to live in the town, for me, it's a little easier for me to kind of see those things and say, oh, that's a little weird. But for people that don't come from this background, or for people that have never been here, I could see how easily they could just be passed by and not even noticed. And then we have social media, which I feel doesn't matter if you're in the middle of nowhere or if you're in a big city. Relationships are formed through these social media platforms. We know that a lot of trafficking has been moved over to that. It's a lot easier than the man in the white van to connect with several different people, find out what their vulnerabilities may be, and build those relationships off of false promises. So we still do see that, if not more, because some of our youth here are in the more rural areas when they're not in school. They're looking for that connection. So the youth in general these days are on their phones, on social media apps all the time. But we do see that a lot with our more rural youth because they're looking for that connection. They may not be able to walk down the street to a friend's house to hang out with them, being in the areas that they live in. So when I first started in this position in 2019, we really had to look at what could we do to develop our response to human trafficking and exploitation? How could we do things differently that would help us specifically here? And it looks different in other rural areas. It looks different in urban areas. You really have to look at your specific community and what the need is there. So we started obviously with our local law enforcement. We have our critical team meetings and our schools. Although we may not have as many referrals for trafficking or exploitation as larger cities or urban areas do, we do have a lot of at risk, and we do really carry education a lot. I think our statistics for last year, we saw 752 youth and 73 adults, and that was between referrals and education, but it was more heavier on the side of the education. So we really pushed with that. Our agency has a good relationship with the schools in our districts, so we just pushed through where we could. So with the schools, we worked with education, we got into classrooms, auditoriums, and that really spread the word to not only the youth, but to teachers, administration as well, that maybe didn't know these signs or weren't as well educated on them, which in turn were able to help them identify, which I'm excited to have my panelists talk about towards the end of this presentation. We've worked with other local agencies. We have our local CAC, we have different agencies that may be more tailored to just specifically our community, and just reached out to fill those gaps, because what I may know, someone else may not, and someone else may be working with a youth that I'm not in contact with. So just opening up that networking and those relationships. Hospitals and healthcare was a big one on my list when I first started. We've trained public health last year in CSEC, which is commercialized sexual exploitation of children. We found this very important because, like I said, in more rural areas, sometimes these youth or even adults that we see that are experiencing this, they may not just be out there in the open on the street, especially given where they live. So where are they going when they have to, which would be school, the doctor's office, hospitals, ERs. So really getting them trained on knowing the signs, knowing who to report to in this county. It's different in every single county and state where you report to, who you report to, how the process works. So really giving them that education so that they know when they come across it. And then, of course, our local Department of Social Services, CPS, we work to build those relationships for different cases that they may have. We see a lot of overlap. So when we talk about rural areas here in Herkimer County, and we think about some of the schools, if we went back to that map that I showed you earlier, we do have a lot of schools that are closely put together, and then we have some of the schools that are kind of further out. So I have been fortunate enough to build a great relationship with the Dolgeville School District in the last couple of years. A coworker of mine is actually a prevention worker through the Herkimer County Prevention Council. She'll tell you what that role is and what that entails. And then, of course, the superintendent, Joseph Gilfus, who has just been wonderful about getting resources out, getting education out, and really understands the needs in his community being in such a rural place. So before I introduce my panelists, something we did with this school last year is every year we try to do some type of event to raise awareness for human trafficking and exploitation in January, being that that's the Human Trafficking Awareness Month. And last year we carried this out through Dolgeville Middle School students. So 7th and 8th grade students were able to see a presentation facilitated by myself, which gave age appropriate information about what trafficking may look like, social media apps, internet safety. And then at the end, what we did was we had blue hearts already printed and put underneath their auditorium seats. And we used the statistic that every 30 seconds, a youth may be at risk of trafficking or already trafficked. So we used those statistics. We put a certain amount of hearts given how many population that we had watching the presentation. And at the end, the students were told to look underneath their chair. And if they had a blue heart, to come up front to really give them a visualization of what the statistics could be, just whether it's in their area or around the country. And it really, I think, drove home to them that this does happen. We don't necessarily see it on the news always, or it's not always talked about, or it's not always perceived the same way that it is on the movies or as they would think online. And it really became an open door for us to be able to have those conversations and be able to get those referrals and further education, which I thought was great. So now I'm very excited to introduce to you my panelists, Superintendent Joseph Gilfus and Herkimer County Prevention Services Coordinator Taylor Borden. Let me see if I can get them on here.
Good morning, everyone.
Good morning.
How about I do myself? Am I on?
Yes, we can see you.
Good afternoon.
Good afternoon.
So Mr. Gilfus, if you want to just introduce yourself and then Taylor can, and I'll go through the question and answers for you guys after.
Sure. First of all, thank you for having me. We love having you connected with our school. It's been a great experience. My name is Joe Gilfus. I'm in my 4th year at Dolgeville. I've been a rural educator for over 30 years. I've been in a few school districts and different regions. Been in Herkimer County for, as I mentioned, about 4 years. Was up in Jefferson County for 16 years prior to that, and spent time in Cayuga County as well. So a little bit about me, and look forward to talking more about Dolgeville and about this important topic.
Hi, my name is Haley Borden. I am the Prevention Services Coordinator here at Dolgeville with Herkimer County Prevention Council, which is a program of Catholic Charities of Herkimer County. I have been serving here since about 2022, and I provide prevention education over on the elementary side of the building, and some over here in the middle and high school side. And I also provide substance abuse prevention counseling supports to the students as well.
Thank you both. So we have this set up as like a question and answer. So I have a few questions for Mr. Gilfus and then a few questions for Taylor. And if you guys have any questions, I can now see the chat where I couldn't when I was sharing the screen, and we will try to get to those as best as we can. So Mr. Gilfus, can you tell me a bit about the community of your school district?
Well, as I was listening to your presentation, your opening, you were kind of describing Dolgeville. We're a very rural school district. There's a lot of poverty. There's a lot of single parent and grandparent raising children, families in our community. One thing that is important to know about Dolgeville that I share with people, they want their children to be safe and they want them to be happy. It's very important. There's a really unique culture in Dolgeville. People are very protective of the youth and children. And I say that through my own eyes and my own lens and my observations. And but I also, Dolgeville is a place where, you know, in going through the statistics and listening to what you just shared, is as vulnerable as any area. You know, looking at the areas of financial support, there's not a lot of employment really in Dolgeville. It used to be an industry run and supported community, and a lot of industry, even though there's some left remaining employment wise, you know, people work really hard and have to work 2 or 3 jobs just to pay the bills. So there's poverty. Again, you have a lot of individuals. I mean, obviously we're spread out. You know, when I think about all the characteristics of, quote, victims of trafficking, I mean, our community, our children, not only the children, but the men and women in our community are as, you know, could be victims just as anybody. So the other thing that we're seeing again, and we're no different, and I hope I don't get too long-winded, is, you know, you mentioned about social media. There's, even though I feel that people want to be connected with people, you know, we often find, I'll stick to our youth, that they'll go to any means to try to find connections. And it seems to be more and more over the social media platforms. And that can be obviously very concerning for a lot of reasons. And, you know, so I think, you know, Dolgeville again is rural. It's a poor district. It's a loving district, a caring district. And the school is the center of Dolgeville. And when we had our Blue Heart Assembly last year, I think it opened the eyes of our, not only our students, but our staff, because, you know, you see the stereotype. You mentioned yourself about the white van, right? When you think, you know, you think about the truck stops. We have a throughway stop just down in Little Falls, right? You have all these images and these stereotypes, but it could be the person down in the village. It could be somebody, the family member. It could be anywhere in our school community, and that's the kind of the scary part when think about victims of trafficking and then the survivors, and what do we do? What do we do to support them? So but Dolgeville is just like any other rural area, it's very vulnerable.
Thank you. And I know you talked about the poverty and the need for connection, but what risk factors are you seeing in youth in relation to exploitation other than those two? Are we seeing correlation with other risk factors that would make them vulnerable?
Well, for me, I think everything's it really, I, I guess, I think a risk factor is about awareness, about understanding, about what's what's right and what's wrong, about behaviors and attitudes and so forth. So I don't, you know, aside aside and who to go to if you see or um, come across something that just doesn't seem right, look right, feel right, whether it's a family member, whether it's an uncle, whether it's a neighbor, a step parent, somebody new to town. We have a lot of, we have a transit population, even in Dolgeville, and we have people come and go. But I think it's really a lot, I think centers around, sure, we have poverty and all these things, but they want to connect with people at all ages, regardless. They want to feel good about themselves. And, there are people out there with bad intentions. And I think trying to help our youth, and I'll stick to our youth, focus and become more aware and educated about, what really is inappropriate and what isn't appropriate behavior, and who to go to if and when you would ever experience anything like that, whether it's your grandparent, your parent, whether it's your people at school. I think it's really, what are the signs, reporting, and really trying to, we can never educate enough. So, but I'm kind of chasing my tail a little bit because I have a
No,
lot
it's
of thoughts.
okay.
So,
No, I agree with you. And I like that you've talked about people being in transit here and us having the three. We do have a heavy three-way presence. We're right in the middle. So as far as even if potentially a youth is being trafficked or groomed by someone that's not from the area, it's not very hard once they make that connection and build that trust for them to then leave the area either, which I know we have seen unfortunately happen as well.
and we've seen that in our school community.
Yes.
So we have, and I'm not going to sit here with this panel or our guest to say that we haven't, because it's a reality. We have experienced it, and we've done everything we've can possibly do to protect our kids. And again, and there's different trafficking as well. You mentioned about farmland. Obviously, there's transit workers in and out in the areas. There's a lot of um, it expands more than what the typical you see on you know Law and Order or these programs. It's just so much deeper. It can even happen. It happens within even families in our communities, and so anyway, and people, they, I think for those individuals who are survivors and become victims of this behavior, they, the whole, how do we instill the strength and knowledge in them to be able to still seek help and not continue that cycle of victimization? That's, for me, is a very big thing. So there's a stigma. You're the person who, quote, you know um, snitched on the family or whatever. I mean, there's a there's a lot of there's a lot of dynamics. But I think trying to better understand through education, what are the signs, what are the next steps, and how do I feel safe, regardless of the situation. So, and not to feel become imprisoned or victimized because I don't have, I have to continue being a victim because I need housing, I need food, you know, all these things. Maybe I I have an addiction that, you know, all the things that everybody on this panel know. But it's, you know, we see it. We see signs.
And I do agree what, like you said, kind of ending that stigma. If they're already in that situation, the more we educate and the more conversations we have, I feel we've seen more comfortability in the students coming forward, even if they're just at risk. Like, hey, you know, I have been talking to someone. It may seem like it's something that we learned about. So I definitely agree with you there.
If I could just
Um,
add one more thing, because I appreciate all the work Catholic Charities and everybody does, and I'm glad for this forum. But I think one really important thing is, you know, I think working together and communicating is the key. Regardless of how many agencies or resources you have, whether it's your local police department, it doesn't matter within the county and the region. We have to work together. We have to continue to work together and just join our resources. And a lot of times we're overlapping. You know, we all have the same goal in every way. We you know, in layering all the resources, I think it's just so important. The communication is everything. So all right, now I'll shut up.
Well, I just want to thank you for getting on this and also just for your school's participation and opening that door. And my hope is that some other schools that maybe we don't have such an open connection, like you said, is very important, that they follow suit and really see how important it is. You know, just because you, like you said, a school, an agency, and law enforcement, we're all in the same county and we're all here to do the same thing. So the more we connect together and work together, I mean, I do believe there is a lot of overlay where, you know, sometimes I might know some information that the other person doesn't know, and it's just helpful to have that open line of communication for sure. So thank you so much.
You're welcome.
Taylor, on to you.
All
Can
right.
you first just explain your role within the school and how you meet with students and that process for those that aren't familiar with the Herkimer County Prevention Council?
Of course. So as a prevention services coordinator, I am able to provide substance use prevention education, like I previously mentioned. So I serve second through sixth grade here, teaching the Too Good for Drugs curriculum as well as the Too Good for Violence curriculum. So really building social emotional learning skills, communication skills, coping skills, all of those really essential, you know, foundations for you know, leading healthy lives and making good decisions and all of that. It's all age appropriate, you know, so as the kids get a little bit older, we start to introduce different topics such as substance use. You know, we talk about tobacco, nicotine, alcohol use, some other drug use, safe use of medications and things like that. And then over on the middle and high school side is where I really kind of jump into the substance use prevention counseling services. So I'm able to meet with students who either are currently using substances or who may be at risk of using, and also provide general support to students who may be experiencing substance use within their family or friends. You know, obviously if they're seeing substance use at home or they're seeing, you know, risky behaviors with their friends, of course, that's a risk factor for them, and other, you know, general support for other issues that the students may be experiencing, whether it's relationship issues, issues with friends, you know, really kind of just general support for them with that focus on substance use prevention.
Thank you. So when you're meeting with students, whether it's just, I know I've been there before, a random knock on your door, or when you're doing the brief intervention counseling with them, how are you able to identify which students may be at risk of exploitation or trafficking?
So part of our assessment and screening process involves identifying student risk factors. So we look at things like poor mental health, engaging in risky behaviors, especially online and with social media, you know, isolation, substance use again, anything like that. So yeah, during that initial assessment and screening process, we're really able to delve into what some of the issues are that some of the students are experiencing. You know, confidentiality is a big piece of that, but letting the kids know that, there are adults who care and want to help them and will support them, that it is a safe space. However, if there are certain things reported where there's a concern for safety or anything like that, the appropriate people need to be brought in, and that the main goal of everybody is their well-being and their safety. So really through that screening process and being able to identify those risky behaviors.
And like I said, from what I've seen in your work with the students in your particular school, they seem to have a very good relationship with you, which I think is huge with the adults and the youth, because then they're more likely to be able to express those things to you, and feel more comfortable doing so. What would you say are the main obstacles or gaps for students in the rural communities, like in Dolgeville, when they're looking for those identified services?
I think, previously mentioned, the main barriers that I see within the community, transportation, lack of resources or lack of services in the area. Poverty is a big one. We are, kind of on the outskirts and isolated a little bit more. Joe has spoke about connection, and everybody wants to feel connected in some capacity, no matter what age you are. And, I think about our students who are not directly in Dolgeville, but, we have our outside townships too, like Salisbury, Stratford, where they're definitely more secluded than even Dolgeville is. So I think about the students out there who aren't able to just, walk down the street to their friend's house or get support if it's needed. So really that isolation is a big risk factor that I see and a big barrier. Another really important one is the stigma that exploitation does not exist or doesn't happen in small towns like this, which, working with Safe Harbor and events like the Blue Heart event really shed light on the reality of exploitation in the world, but really in small towns too. And it really prepares the students and staff what to look out for, internet safety, how to be safe and what to look out for.
Thank you. And can you just talk a little bit about your experience with referring or working with Safe Harbor for students that you identify are at risk or maybe already, be in that lifestyle?
Yeah. Personally, for me, I think, I've attended many of your trainings and have had many conversations with you. I feel personally that I am better equipped to help identify any at-risk students, and our collaboration through you and through you and the school, has really given me the opportunity to make referrals and connect the students to Safe Harbor services. And, based on student feedback, they've really benefited from working with you in Safe Harbor as well, and from the presentations too. So, I think that pushing that education piece is so important. And to just let the kids know that this is a very real thing, and they may even be participating in it and not realizing it. So really just opening their eyes to it is important.
I agree. And then on my end of things, coming in, I do the other program that I direct as well, that we've also been very lucky to push into your school with. It does help being able to come in and see a youth where maybe they've had involvement with police or social services, and so they see someone walking in with a badge and they may be wary. It does help to have that referral come from yourself or Mr. Gilfus, because then they're trusting who you're referring to. It kind of bridges that gap, and it makes it more able to, whether they've seen me in school for presentations or if they've never seen me before, if a lot of times they're like, oh, well, Miss Borden sent me here for a referral, come to talk to you, and they're just more comfortable with doing so.
Absolutely.
So I really do thank you both for just being so open with your school district, and going back to what Mr. Gilfus said, that we know that the families are very protective of our youth here, right? And they want to both give them the education, but also protect them at the same time. And we do find that with schools, it can be hard to be let into those places to be able to do education, because they have to trust the person facilitating, that they're well qualified and trained, that it's age appropriate material. And like I said, I just hope we continue this relationship going forward and inspire some other schools and districts in our area to do the same, because the more these kids know, the more the adults know, and just our community as a whole, I think we can really make a bigger difference than we have been, which has already been amazing.
Agreed.
Absolutely. Thank you so much, Taylor.
Thank you both so much. Does anyone in the chat have any questions for us before I let my co-hosts go? Oh, we have one. Let's see. Love this and love that the school is allowing your involvement. Me too. As a superintendent, so Mr. Gilfus, this would be for you. What encouragement would you offer to another district who has not benefited from Safe Harbor to involve or invite staff to their district? No pressure.
Well, no, I actually was going to offer if I would, I do talk to my colleagues in the region. We do share, information with different experiences, different programs that we bring to our districts and so forth. I have spoken to this topic, and I would be willing to talk to to reinitiate that conversation again with my group in the Herkimer County BOCES region. Our relationship has been rock solid. It continues to grow. Um, you guys have a ton of energy. You do exactly what you say you're going to do, and and the presentation was extremely well received by our students and our staff, as I mentioned, and you know, I it was a great exposure educationally, and I think it left people with a lot of questions, and probably connected some dots for people, fortunately, because now they can become more educated. They understand, what's potentially dangerous and possible out there, and between what's right and wrong. But I would be willing to talk to anybody. If anybody on here or wherever, whether it's a school, whether it's a non-for-profit organization or whatever, I'm game anytime. It's been a great experience. I'm looking forward to more education opportunities to expand on it, because I don't think it's a topic that you can shy away from. I think you have to just continuously keep it out there for people to be thinking about, to recognize it, and just keep reinforcing, this really pushing the educational part of it, the awareness of it, and what to do if you encounter it, whether it's yourself or somebody you really care about, or it could be your neighbor, it could be anybody. So,
Thank you. I really appreciate that.
mhm.
Does anyone else have any other questions or comments? I don't see any, but if you think of any questions in the meantime or after this presentation, I will put my email in the chat for you. And feel free to ask me questions. I can also forward questions to Mr. Gilfus or Taylor if they're personalized to their jobs or what they need. Shannon, thank you, Taylor, and Joseph, for your presentation. This will also be recorded on the OCFS YouTube channel, so I will make sure I get that link and send that to you both as well to distribute where you see necessary.
Great.
Tina said, excellent. Thank you all for taking the time out today to watch this webinar. Really hope that you gain some knowledge from it. And like I said, if there's any questions that you may think of afterwards, please feel free to reach out on my email.
Thank you. Thanks for putting this all together.
Thank you, guys.
Thank you.